I think we've all been just scrambling to address the multiple uncertain issues related to the COVID response. Of course, the pandemic has shifted course over and over again, and there are many unknowns and uncertainties. Less certain is what this will mean for recovery. So we've seen several countries go through spikes in a number of cases and then a downturn, often another spike. So there's a lot of uncertainty as to when this will be over. With uncertainty, there's also a tendency in public health to look for tangible facts, measurable numbers, and mathematical predictions that people are more comfortable with to provide some measure of certainty. What I think that this misses is that there's this disproportionate impact on vulnerable communities and how the pandemic and its response has exacerbated those vulnerabilities. So several researchers, particularly in the social sciences, have underscored this vital point that this is more than just a health crisis. It is a crisis that heightens the fractures and fault lines in our societies. And because of this fracturing, we've seen that rising inequality over the past several decades is really coming to the fore. We've seen the Black Lives Matter uprisings in the US, political crises in several countries like Chile, Uganda, and so on. And we've also seen challenges to Prime Minister Modi's and the BJP's Hindutva agenda in India. So while there's no doubt that the pandemic has had a negative impact, I really wonder whether we'll finally learn some lessons and rebuild a new and more socially just world. And so to answer your question, I think that this issue will really allow us, this bulletin issue will allow us to preemptively think about what a post-COVID societal transformation could look like in a way that supports the most vulnerable and tackles inequalities head on. So in our article, we've highlighted COVID-19 from a syndemic perspective, describing how COVID-19 acts on or thrives on local vulnerabilities. So a syndemic, according to Meryl Singer, describes this kind of population level clustering of social and health problems. Specifically, it includes two or more diseases or health conditions that cluster. So with COVID, this could be COVID-19 and any locally prevalent comorbidity. It also very importantly includes the local contextual factors that create those conditions. For example, violence, inequality, marginalization, systemic racism, any of the above. So this second piece is really important, and it's often forgotten when talking about COVID-19. And so here I'm going to highlight what Richard Horton said in The Lancet last year about COVID being not necessarily just a pandemic, but syndemic. And then the more important piece about context was highlighted by Emily Mendenhall, who reminded us that syndemics focus on local conditions that cause diseases to cluster and interact. So Dr. Mendenhall reminded us that syndemics allow us to recognize how political and social factors drive, perpetuate, or worsen the emergence or clustering of diseases. So in our article, we highlight how COVID can be syndemic. We draw on evidence from low and middle income countries to highlight the local vulnerabilities that drive COVID's interactions with those local conditions. So what we're really talking about here is how, for example, urban informal settlements, there's a lack of water, sanitation, and hygiene that prevents putting COVID-19 prevention recommendations into action. Further, chronic conditions, as Annie Wilkinson wrote about, are vastly undercounted in informal settlements, and so we can't even be sure of how COVID biologically interacts in some places. We're also discussing in this article how the COVID-19 response may have exacerbated vulnerabilities that underpin a syndemic. For example, vulnerable populations like sex workers occupy an already precarious space in many societies and were negatively affected by lockdowns that further drove their work underground into more dangerous spaces. So I think donors can coordinate better across sectors to better tackle the linkages between health outcomes and their social determinants. I think donors, and this article encourages donors to think creatively about the need to synergize public health and development. So more cross-cutting dialogue would be needed. And as many of us at IDS have argued, I think donors can also prioritize locally adapted responses to COVID-19 and the socioeconomic fallout that really put community members and organizations at the forefront and recognize them as partners in any response and not just beneficiaries. So, the one thing I'd like readers to take away from our article is that the pandemic has challenged global societies in many different ways. And by highlighting that this is not just a public health crisis, but it is a political, economic, and social crisis, we hope that readers will help us to reimagine what society can look like post COVID 19. So let's hope that all of the struggles and challenges we've all faced over the last year plus are not for nothing.